Yes, this is the left-sided dissected upper limb specimen. Can you all identify? It's of the left side, right? So here we'll be identifying the brachial plexus. Okay, we'll identify the different parts of brachial plexus that are visible. So for identification of different parts of brachial plexus, first you need to identify this muscle. Okay, this muscle is called as coracobrachialis muscle. Okay, so the left arm, we can see this is the biceps brachii muscle. The muscle medial to it, this muscle is coracobrachialis muscle. Okay, there is one nerve which pierces this muscle. Okay, we can see this nerve. This nerve is the musculocutaneous nerve. Okay, musculocutaneous nerve is the nerve which pierces the coracobrachialis muscle. So when we trace this musculocutaneous nerve behind this nerve, this is referred to as the lateral cord of the brachial plexus. Okay, because we know musculocutaneous nerve arises from the lateral cord of the brachial plexus. Okay, and from the lateral cord we know there is one more branch called as the lateral root of the median nerve. Okay, so that branch is this. This is the lateral root of the median nerve. When we trace this lateral root of median nerve downwards, we find this. This is the median nerve. Okay, when we trace this median nerve upwards, again we are able to see one more root. This root is the medial root of the median nerve. Okay, so till this point it is clear. First we identified the musculocutaneous nerve. We reached to the lateral cord, and this is the lateral root of median nerve. Median nerve, lateral root is joined by the medial root. Okay, so lateral root and medial root uniting to form the median nerve. Medial root, when we trace behind, will reach to the medial cord of the brachial plexus. So this is the medial cord of brachial plexus, and the largest branch from the medial cord is this. This is the ulnar nerve. Okay, this nerve you can trace down. It will be going behind the medial epicondyle of the humerus. Okay, so this is the ulnar nerve. Okay, so now, just like I told you, you have to identify something called as M pattern in the brachial plexus. So try to identify that M now. One limb of the M is formed by this musculocutaneous nerve. Intermediate part is formed by two roots of the median nerve, and this another limb of M is formed by the ulnar nerve. Okay, so this is the, this one is musculocutaneous nerve. Musculocutaneous nerve, two roots of median nerve, and the ulnar nerve. Okay, so identification of this musculocutaneous nerve, median nerve, ulnar nerve, and radial nerve. Okay, all these major branches you need to identify. So how to identify the radial nerve? So to identify the radial nerve, you have to go behind the axillary artery. Okay, this artery that we can see here, this is the region of axilla. This is the axillary artery. Okay, now behind the axillary artery, which is going down, okay, a thick nerve. Let's try to identify that. So this one is the radial nerve. Okay, so apart from this M pattern, if you find any thick nerve behind the axillary artery, then that would be the radial nerve. Simplest way to identify. Okay, and radial nerve, if you have identified, we are actually going towards the posterior cord, and from the posterior cord, this nerve was seen axillary nerve. Okay, going towards the surgical neck of the humerus. Okay, yes, yes, one, there is one small nerves are seen. So there one above would be the upper subscapular nerve, lower one is the lower subscapular nerve. Okay, so these branches to be identified, and let's see the vessels. This is the axillary artery. Axillary artery will continue as brachial artery at what level? When it crosses the lower border of teres major muscle. Okay, and axillary artery has got three parts, which is it is divided by which muscle? Pectoralis minor muscle. Okay, this is the pectoralis minor muscle. What are the branches of first part of axillary artery? Superior thoracic artery. Superior thoracic artery. Branches of second part? Acromiothoracic and lateral thoracic. Two branches from the second part are acromiothoracic, lateral thoracic. And from the third part of axillary artery, there are three branches: subscapular artery, circumflex, humeral artery. Okay, anterior and the posterior circumflex, humeral artery. So out of which at least the subscapular artery we should be able to identify, because that is the largest of all the branches. Okay, we can see this artery, a thick artery going towards the scapula. This is the subscapular artery. Okay, apart from this I cannot find any other thick branch. Okay, subscapular artery is usually identified as the thickest branch amongst all other branches of axillary artery. Okay, and this cords of the brachial plexus are named based on the relations around the second part of the axillary artery.